Picture this. You just returned from a major medical congress and you are buzzing with insights that could reshape treatment paradigms. And now you try sharing this with your commercial colleagues. I must say, this was one of the best medical congresses I've ever been to, especially when Professor Norton described how they identified the new lambda receptor on the epithelial cells. And also he talked about how this lambda receptor could eventually, we can say that our drug is better? Well, it's not that simple. Okay, but just send me whatever we are allowed to say. Okay? Thank you. See you. If that felt familiar, you're not alone. I'm Mats Folkvist. I'm the CEO of Crossfell. And today we're going to talk about the massive, untapped strategic value of medical affairs that somehow gets lost in translation. If you think about it, medical affairs sits at the crossroads of science and strategy, fluent in clinical evidence and in healthcare professionals' priorities. They are not just scientific gatekeepers, they are also intelligence gatherers with unique access to insights that could drive competitive advantage, but more importantly, better patient outcomes. But here's where things typically go wrong. Overwhelming colleagues with technical detail that can't translate to action. Being seen only as the team that says what you can't do. And constantly responding to urgent requests with no time for strategic thinking. And the result? Incredibly valuable scientific intelligence being locked up within medical affairs, never being translated into strategic action that could benefit patients, healthcare systems, and your company. The solution is a simple yet very effective two-step process that transforms medical affairs from scientific support to strategic catalyst. Step 1 involves capturing and categorizing intelligence into what we call the SOS framework. Because every interaction with a stakeholder is an opportunity to gather intelligence into 3 different categories: strategic and economic, operational excellence, and scientific and healthcare environment. When used systematically, capture intelligence within these 3 categories, you begin building a strategic intelligence depository that's far more valuable than any traditional meeting reports. And once we have valuable strategic intelligence, we're ready to move to step 2. In step 2, we transform raw intelligence into strategic opportunities using our Connect framework. Connect takes your captured SOS intelligence and, with the help of AI, identifies potential triple win opportunities. A win for patients, a win for healthcare systems, and a win for your company. For example, your SOS intelligence might reveal that several oncologists mention challenges with treatment sequencing for a specific patient subgroup, and hospital administrators are concerned about resource utilization for these complex cases. And payers are focusing on reducing unnecessary hospitalizations. Connect processes these seemingly disparate insights and generates a strategic opportunity, developing a treatment pathway optimization initiative that improves patient outcomes, enhances healthcare efficiency, and positions your therapy optimally within the treatment paradigm. The key difference? Instead of just sharing scientific data, you are now bringing forward strategically valuable opportunities that impacts real-world challenges. Now, medical affairs becomes a strategic catalyst in 2 powerful ways. When meeting with your commercial colleagues, you're no longer just the scientific experts. You're presenting data-driven strategic opportunities derived from deep customer insights. Based on our systematic intelligence gathering, we have identified a significant gap in the treatment pathway that's causing delays for 30% of eligible patients. Here's a strategic initiative that could address this gap, improve patient outcomes, optimize healthcare resources, and strengthen our brand position. And when engaging external stakeholders, you shift from product-focused conversations to exploring mutual opportunities. I understand your department is facing challenges with treatment sequencing decisions. And we've been analyzing this issue across multiple institutions and have gathered some interesting insights. Would you be interested in discussing approaches that might optimize this part of the patient journey? And each stakeholder engagement, of course, generates new intelligence that feeds right back into the SOS framework and Connect, and thus creating a continuous cycle of intelligence-driven opportunity generation. And here's an example of one medical team that put this approach into practice. They systematically captured intelligence from KOL conversations using the SOS categories. They fed this intelligence into Connect, which identified a pattern around treatment sequencing challenges. Connect generated a strategic opportunity, developing a decision support tool for complex treatment sequencing. The team presented this opportunity to commercial colleagues who immediately saw the strategic value. They engaged key stakeholders around this opportunity, gathering deeper insights. And finally, they co-created a solution that improved patient outcomes, optimized healthcare resources, and strengthened their brand position. And the end result? Well, this medical affairs team transformed from a reactive scientific support function to a proactive strategic catalyst, driving measurable value for patients, the healthcare system, and the company. So, when medical affairs systematically captures intelligence and use that intelligence to generate win-win-win opportunities, they become the bridge between scientific expertise and business impact. They create value not by simplifying science, but by translating it into strategic opportunities. Opportunities that everyone can rally behind. So are you ready to unlock the strategic potentials for medical affairs? I'd be happy to give you in just 30 minutes a demonstration of the power of the SOS framework and Connect. And I promise you, you're gonna be surprised. And if you want to take me up on that offer, just send me a message here on LinkedIn or send me an email to mats@crossfell.se. From scientific expert to strategic catalyst, the transformation of medical affairs begins now.